because we
Sure.
spoke about that,
Yeah.
you know, that who would freeze their eggs and who wouldn't. How do you feel about that?
Egg freezing is something that's really, although egg freezing technically has been possible for many years, from the time that we learned how to freeze an embryo, it's been very challenging because the old system of freezing incurred a slow freeze, and that allowed crystallization of fluids. The egg is a cell that has a lot of water, so it crystallizes and it damages eggs. However, a breakthrough really back in sort of, you know, the last 3 to 5 years has basically meant called vitrification, which is a freeze technology, which is a rapid freeze technique, has really opened up the door right now to the question of, can we now freeze eggs? And the answer is yes, we can, with a much better, a very high success rate that they thaw successfully and that they fertilize. And this now really opens up the question of, can we now prevent infertility? Because one of the challenges is, as we said, people are now building careers, they don't want to have kids at a young age, they want to consider this more in their later 30s or early 40s, but perhaps the time clock and the biological clock has already talked at that point.
But do you have a lot of young women who
That's
are
what I
doing
want to
that?
ask
I think
you.
this is an area that is very new, and I think it's something that basically
In the Caribbean
it's
especially.
awareness. I mean, we freeze, we have an egg freezing program. Ultimately, the uptake on it is due to awareness, and what it involves is someone making an elective decision at a young age. So they could be 30 and decide, okay, well, I'm going to continue my career, and I'm going to perhaps between 30 and 35 going to freeze my eggs electively. And if you like, that is an insurance policy against what if in the future I have infertility. So they might actually decide that they're having children in 3 years' time and conceive naturally. But at the same point, I think that certainly the option of egg freezing is an exciting area. I think that it's the first opportunity we've had to have a real solution to this problem. But it does involve her to go through IVF and freeze her eggs. And the benefit is that obviously as egg freezing, they're frozen as a gamete. So then she can choose her male partner in time to come. Whereas she could also use a sperm donor, but in which case the embryo is frozen as an embryo and it has the male genetics in it.